These pills are stealing your memories. Imagine taking a pill tonight to sleep better. Now imagine that same pill erasing tomorrow's memories without warning. Or maybe it creates that mental fog, preventing clear thinking during the day. A groundbreaking 2024 study published in JAMA Neurology revealed a terrifying connection between continuous medication use and brain atrophy. The research showed these drugs shrink brain tissue. They increase dementia risk by up to 50%. Here is what viewers will discover today. First, the 5 medication groups secretly inflaming brain tissue will be revealed. Second, the hidden scoring system scientists use to measure this danger will be explained. This anticholinergic burden scale acts like a secret scorecard for brain health. Understanding it could protect millions from cognitive decline. But here is the mystery that will unfold throughout this presentation. Why does medication number 1 shock every person who hears about it? Millions purchase it without prescription. They assume it is harmless. Yet it carries the maximum danger score for brain health. The answer lies hidden in medicine cabinets across America. Understanding the chemical culprit. The brain requires specific building blocks to construct memories and maintain focus. Acetylcholine serves as that essential neurotransmitter. Without properly functioning acetylcholine, memory formation becomes impossible. The body must manufacture this chemical from choline obtained through diet. Eggs provide excellent choline, especially in the yolk. Liver, meats, fish, and soybeans contain substantial amounts. Vegetables like broccoli and cauliflower also supply this crucial nutrient. Anticholinergic medications destroy these vital building blocks. They shatter acetylcholine molecules into fragments. The chemical essentially turns to dust. Consequences appear immediately in daily life. Names vanish from memory mid-conversation. Words hover frustratingly on the tongue's tip. Important thoughts disappear like smoke. Mental clarity becomes increasingly elusive. The mechanism behind brain shrinkage raises alarming questions. Recent neuroimaging studies paint a disturbing picture. Chronic acetylcholine blocking does more than disrupt neural communication. Research suggests these drugs amplify brain inflammation significantly. Even more concerning is their potential to accelerate beta-amyloid plaque accumulation. These exact plaques define Alzheimer's disease pathology. A 2025 JAMA article revealed an even stronger association. The connection between these medications and vascular dementia appears undeniable. This suggests a dual damage mechanism. Beyond sabotaging neuron communication, these drugs trigger inflammatory changes. They harm blood flow throughout cerebral tissue. Small brain vessels suffer progressive damage. Scientists created the anticholinergic cognitive burden scale to quantify this destruction. The scoring system explained. The ACB scale ranges from 1 to 3. Higher scores indicate greater danger to cognitive function. Before revealing the dangerous medication list, a personal challenge is necessary. Conduct a medicine cabinet audit right now. Pause and locate that box containing all medications. Every bottle deserves careful examination. For each item mentioned, check personal medications thoroughly. Search for hidden villains lurking behind brand names. Ignore the large commercial name displayed prominently. Marketing created those names for recognition. The active ingredient reveals truth. Look for the composition in small print, usually found on sides or back panels. Note the score if any dangerous ingredient appears. The hunt begins now. Medication number 5. Urinary incontinence drugs. Many prescribed medications for overactive bladder are potent anticholinergics. They relax bladder muscles effectively. However, blocking acetylcholine throughout the entire body creates problems. The brain suffers collateral damage from this widespread blockade. Millions rely on oxybutynin to control bladder hyperactivity. These drugs work efficiently for their intended purpose, but the price paid is staggeringly high. They carry a score of 3. That represents maximum risk on the brain health scale. Before accepting this prescription, discuss safer alternatives with physicians. Mirabegron earns a 0 score. Pelvic floor physical therapy offers effective results. Kegel exercises strengthen muscles without chemical intervention. Yet protecting the brain from bladder medication means nothing if another common problem receives dangerous treatment. This brings the discussion to medication number 4. Medication number 4. Cramp and irritable bowel medications. That familiar medication for cramps carries hidden dangers. Many people recognize the brand immediately. These drugs function as antispasmodics. They relax intestinal muscles by blocking acetylcholine. The most common contains scopolamine as its active ingredient. Muscles throughout the digestive tract respond to this chemical. Unfortunately, brain communication also relaxes under its influence. It scores a 1 on the danger scale. That might seem minimal initially. However, chronic use creates a constant drip of risk, like water wearing down stone over time. For irritable bowel syndrome, explore alternatives with medical professionals. Peppermint oil shows promising results. Probiotics support gut health effectively. Dietary modifications reduce symptoms substantially. Stress management addresses root causes. If a simple cramp medication raises concerns, the next category becomes even more serious. Medication number 3. Certain antidepressants and anxiety medications. Mental health medications affect millions of Americans daily. Some carry maximum danger scores. Older tricyclic antidepressants possess strong anticholinergic properties. Amitriptyline represents this category well. Clomipramine shares similar risks. Even hydroxyzine, commonly used for allergies, demonstrates extremely potent effects. These medications definitely cause sedation. All carry the maximum score of 3. Never discontinue psychiatric medications without professional guidance. This warning cannot be emphasized enough strongly. Modern alternatives exist with 0 danger scores. Sertraline works effectively for many patients. Escitalopram provides another safe option. For anxiety and insomnia, trazodone offers minimal anticholinergic effects, perhaps none at all. Discuss these options during the next medical appointment. Bladder, intestines, and mental health have been addressed. But what about that back pain? The muscle relaxant taken regularly might harm cognitive function. Medication. Number 2. Muscle relaxants. Cyclobenzaprine is among America's most prescribed medications. The drowsiness it causes signals direct brain effects. These effects are not gentle or temporary. This drug carries a score of 3, the highest possible rating on the risk scale. Occasional use presents minimal concern. Chronic use for pain management creates serious memory dangers. Chronic pain requires comprehensive treatment approaches. Physical therapy addresses underlying causes. Strengthening exercises prevent future problems. Safer analgesics manage discomfort effectively. Treating root causes prevents symptom masking. Sedatives should never replace proper pain management. If this information seems concerning, prepare for what comes next. The number 1 medication has arrived, the champion of cognitive danger. Earlier promises will now be fulfilled. This medication is most dangerous for one specific reason. Everyone assumes it is completely harmless. It hides in plain sight throughout households. Medication number 1, diphenhydramine and dimenhydrinate. Why does this claim the championship? Not because of potency alone. Its danger stems from widespread availability. Millions underestimate its risks completely. Those familiar cough drops contain diphenhydramine. Think of popular brands sold everywhere. Dimenhydrinate deserves recognition too. Most people know it by another name. Dramamine rings a bell. Both are extraordinarily potent anticholinergics. They score the maximum 3. They cross the blood-brain barrier with remarkable ease. This explains their sedative effects. Taking Dramamine for travel sickness seems reasonable. Using it for nausea or vertigo occasionally causes no alarm. But taking half a pill nightly for sleep? That habit literally doses the brain daily. It represents one of the largest known dementia risk factors. Science has confirmed this connection repeatedly. Safer alternatives exist. For allergies, modern options carry 0 scores. Loratadine works without cognitive risks. Fexofenadine provides effective relief safely. For insomnia, investigate underlying causes first. Melatonin supports natural sleep cycles. Magnesium threonate crosses the blood-brain barrier. Sleep hygiene practices improve rest quality. Never use a cannon to kill an ant, especially when that cannon aims at one's own head. The cumulative danger revealed. The medicine cabinet audit revealed hidden risks throughout. The goal is awareness, not panic. Here is the critical point most people miss. Suppose one medication for cramps scores a 1. Another muscle relaxant for back pain scores 3. The total risk does not stay at 1 or 3. These scores add together. In this example, the cumulative anticholinergic burden reaches 4. Studies demonstrate clear patterns. A total score of 3 or higher maintained over time associates strongly with brain damage. It resembles taking small poison doses daily. One dose might cause no harm. Multiple doses from various sources compound over time. The effect multiplies exponentially. This explains why complete medicine cabinet audits prove vital. Consider a real-world scenario for perspective. Picture Uncle Robert, 78 years old. He remains active and engaged. Recently, forgetfulness has increased noticeably. Small things disappear first. Car keys go missing frequently. Famous actors' names vanish mid-conversation. Family members joke about aging. They assume it is natural decline. Uncle Robert also struggles with stubborn insomnia. Every night for years, he takes one small pill. Just one pill to help him sleep. Nobody ever connected these two patterns. Nobody imagined his sleep medication was eroding memory. Night after night, it undermined his ability to remember. Even breakfast details slipped away. Robert's story is not fictional. It unfolds silently in thousands of American homes. The most shocking statistic. Researchers estimate approximately 10% of all dementia diagnoses trace directly to anticholinergic medication use. Consider that proportion carefully. It compares to other famous risk factors. Hypertension contributes similarly to dementia. Diabetes shares comparable impact. This means 1 in every 10 dementia cases could potentially be prevented. Understanding this brings hope and responsibility. One of health's most powerful principles applies here. The intelligent substitution principle changes everything. This is not about abandoning necessary medications. Panic serves no purpose. This is about upgrading treatment approaches. Exchange solutions that extract hidden brain costs. Replace them with options that solve problems safely. The smart substitution principle. During the next medical appointment, ask specific questions. Request the anticholinergic risk score for current medications. Inquire about applying intelligent substitution principles. Discuss protecting brain health during treatment. Doctors appreciate informed patients who ask thoughtful questions. Now that dangerous medications are identified, the golden question arises. What actions protect and strengthen brain function? What steps boost memory capacity? The loop opened at the beginning closes here. Understanding these 5 medication categories provides the first layer of protection. Knowing the scoring system adds another defensive layer. Implementing intelligent substitutions completes the shield. But protection represents only half the equation. Active brain enhancement requires additional strategies. Nutrition plays a fundamental role. Choline-rich foods support acetylcholine production naturally. Eggs remain the gold standard. Liver provides exceptional nutrient density. Fish supplies omega-3 fatty acids. These support overall cognitive function remarkably well. Exercise benefits brain health profoundly. Cardiovascular activity increases blood flow to cerebral tissue. Strength training supports metabolic health. Both reduce dementia risk substantially. Mental stimulation keeps neural pathways active. Learning new skills builds cognitive reserve. Social engagement protects against decline. Quality sleep cannot be overemphasized. During deep sleep, the brain clears metabolic waste. This includes beta-amyloid proteins. Poor sleep allows these toxins to accumulate. They contribute to neurodegeneration over time. Address sleep problems with non-pharmacological approaches first. Reserve medications for situations where benefits clearly outweigh risks. Closing the narrative loop. The mystery from the beginning finally resolves completely. Medication number 1 shocks everyone because of its deceptive innocence. Diphenhydramine and dimenhydrinate sit in medicine cabinets nationwide. Parents give them to children for allergies. Adults take them casually for occasional sleep. Nobody suspects the cognitive danger lurking inside, yet science proves the connection beyond doubt. This knowledge empowers protection of loved ones. Parents, grandparents, siblings, and friends all deserve this information. Sharing creates ripples of awareness through communities. Every person has the power to change their cognitive destiny. Small decisions compound over time. Choosing safer medications today protects memories tomorrow. Asking doctors informed questions demonstrates self-advocacy. Reading medication labels prevents accidental harm. These simple actions create profound long-term benefits. Knowledge without action remains powerless. Implementation transforms understanding into results. Schedule that medical appointment this week. Bring the medication list from the cabinet audit. Discuss alternatives with healthcare providers. Make informed decisions based on complete information. Remember that cognitive health represents one of life's greatest treasures. Protecting it requires vigilance and wisdom. The brain deserves the same care given to other vital organs, perhaps even more attention. After all, the brain houses consciousness itself. It stores every precious memory. It enables every meaningful connection. Share this information widely. Help others understand these hidden dangers. Subscribe to receive more health insights. Together, communities can reduce preventable dementia cases. Every person educated represents potential lives improved. Every medication substituted could save someone's cognitive future. The power to protect brain health lies within reach. Grasp it firmly and use it wisely.